Welcome to the fourth episode of Let the Adventure Begin. Becoming a new mom is a wonderful, life-changing experience, but also comes with its own set of challenges, as I'm sure many of you know. Today, we're joined by psychologist Melina Spirito from ChristianaCare Center for Women's Emotional Wellness to discuss perinatal mood disorder and available resources. Melina, thank you so much for joining us today.
Thank you so much for having me. It's great to be here.
So why don't you start by introducing yourself to our audience?
Okay. Again, my name is Melina Spirito. I am a licensed psychologist working at ChristianaCare in the Center for Women's Emotional Wellness. I've been part of this community for about 8 years, working specifically with the perinatal population, which means I work with people from the point of conception or family planning all the way up through the first year postpartum. And that includes individuals who are working with reproductive assistance like IVF, as well as individuals who are coping with a pregnancy or neonatal loss.
So for context to our viewers, if you're joining us and you've previously given birth at ChristianaCare, you may recognize Melina, and I'll ask her in a second to show you why. She is also a mom and has given birth here at Christiana and was our cover model for a lot of our maternity a few years back.
Yes. I've had 2 babies here. I've been privileged to have 2 babies here at Christiana. So I know our system very, very well inside and out, both as a professional and as a birthing mom.
That's fantastic. So for those who are watching who are new, who are unfamiliar with the work that you do and the Center for Women's Emotional Wellness, give us an overview of the center.
So we are a comprehensive mental health center. We are an outpatient practice primarily, and we work, like I said, with the perinatal population. So again, we define that as working with folks who are either actively planning a pregnancy, currently pregnant, or up to 1 year postpartum, including those who are working with reproductive assistance or have experienced miscarriage or neonatal loss. Our staff is made up of both licensed therapists as well as psychiatric providers that have advanced training in reproductive psychiatry. All of our staff have advanced training in working with perinatal mood and anxiety disorders. We provide clinical intakes, outpatient therapy, and psychiatric medication management. We also have a few virtual support groups that we offer focused on understanding perinatal mood and anxiety disorders, general support for the perinatal population, and mindfulness for pregnancy and postpartum. And we also offer inpatient consultation as well for obstetrical units. And we work collaboratively as a team to make sure that our patients are getting the best possible care across therapists and their psychiatric providers. And we also connect routinely with our OB providers to make sure that patients are getting the best possible care.
So let's deep dive a little bit into the perinatal mood disorders. You know, I'm 29 weeks and had not heard about it until we started working together for this series. How is it different than, postpartum depression and the other terms that people more commonly use?
Sure. Great question. So perinatal mood and anxiety disorders is really like an umbrella term that we use to highlight the spectrum of mental health challenges or emotional challenges that an individual might experience in pregnancy or the postpartum year. So this can really refer to depression, anxiety, obsessive compulsive disorder, bipolar disorder, trauma, including post-traumatic stress disorder, and rarely, but seriously, psychosis. And so we really like to use that term, perinatal mood and anxiety disorder, because it's more comprehensive. We want folks to know that this isn't something that's just limited to the postpartum period, and it's not just limited to depression. I always tell folks, this isn't just about tissue boxes and tears. It's a lot bigger than that. And so we like that term. And for sure, you'll hear my colleagues and folks in the field saying PMADs. So perinatal mood and anxiety disorders, that's the term we like to use.
I ask this question anytime we really talk about mental health here on ChristianaCare's platforms. Why is it important that we are even having this conversation today?
Thank you. Yeah, it's super important. So when it comes to perinatal mood and anxiety disorders, I always remind folks this is the #1 complication of pregnancy and childbirth. 1 in 5 individuals will experience challenges with mental health during pregnancy or in that first year postpartum, which is an extremely high number, 20%. We know that that is much bigger than any other medical complication that generally arises in pregnancy or postpartum. And that number is actually even bigger when we talk about Black and Brown individuals, as well as people living in poverty and folks that have a past history of mental health challenge or trauma. So we're really talking about something that impacts a significant population and can have really serious ramifications if it's left untreated. I always tell people perinatal mood and anxiety disorders is really, really treatable, but folks need to be able to get the help.
Absolutely. And I'll take this time to remind our viewers that if you have any questions about perinatal mood and anxiety disorders, to please leave those in the comments below and we'll get to them throughout our conversation. Now, Melina, what should we be looking for? You know, some people, they probably think, oh, it's just hormones, or, you know, it's the baby blues and the things that we kind of automatically just write off as being pregnant and emotional or whatever the case may be. But what symptoms should we as pregnant women and our families be looking out for?
Sure. So 2 things there. First, I'll start with how do we differentiate, you know, what is just hormones or the baby blues versus like something that's more serious. So I always tell people baby blues are a real thing. It impacts like, you know, anywhere from 80 to 90% of postpartum individuals. But those symptoms, which are often sadness, anxiety, sense of being overwhelmed, those symptoms generally last for, you know, a week, maybe 2 at the most. They're not symptoms that are going to be persisting like all day long. It's just moments of the day, and they get better within a week or 2 without any treatment. When we're talking about something like perinatal mood and anxiety disorders, we're talking about something that's going to be more persistent. So I always ask folks to think about how frequently are these symptoms coming up? How long are they lasting, and how much distress are they causing? In general, when we're talking about a disorder, we're talking about something that's taking up the better part of the day for days and weeks on end. And it's getting in the way of somebody being able to function the way they want to. It's getting in the way of them being able to enjoy their pregnancy, enjoy the postpartum period, or their families seeing them and saying, hey, you're not functioning the way you normally do. We're worried about you. When it comes to symptoms, the things that I always want people to be looking out for, when we're talking about depression, we're talking about symptoms of sadness, tearfulness, feelings of hopelessness, withdrawal, not wanting to engage in things the way that you normally would, or not getting enjoyment out of the things that you normally would, feelings of irritability, anger, maybe even rage, difficulties bonding or connecting with the baby, and excessive feelings of guilt or feelings of being a failure, like you're letting yourself or your family down. When we're talking about anxiety, the biggest things that we look for are excessive worry and a sense of being overwhelmed, nervousness or restlessness, or maybe even episodes of panic, excessive efforts to try to control the environment around you, and lots of fear that you might not be able to cope with challenges that you might face, and fear of something terrible or something awful happening. Those are really the biggest things that we talk about in terms of symptoms. And I would like to say one more thing about sleep. Sleep is always going to be a question that comes up when we're looking at disorders, whether it be about depression or anxiety. And I know that can be really complicated during pregnancy and postpartum because we expect that there's going to be sleep challenges. And so what I tell people is, especially after the baby's been born, when I ask about sleep challenges, what I'm referring to is when all is quiet, when the baby's sleeping and you have the opportunity to sleep, are you able to lay down and fall asleep? Or are you being kept awake because of racing thoughts, worry, feelings of sadness or overwhelm? That's a sign that we're having some concerns and we might want to get that checked out with a doctor or a therapist.
right now, as all of us are living in the middle of a pandemic, anxiety is something a lot of people are feeling for the first time, no matter who you are. So how are you seeing this pandemic and COVID anxiety impact your patients that you're working with?
Oh yeah, it's definitely impacting them. Just like you said, it's impacting everybody, and it's certainly impacting the perinatal population. I think that what we're seeing the most is the ramifications of a loss of support. This is a time where, my colleagues and I are constantly encouraging our patients to reach out and get support from friends and family and engage people in helping them through this time. And now with COVID, it's really difficult for folks to do that. There's been so many sort of recommendations and restrictions put out there regarding distancing that have made it really isolating for our perinatal population. So it's leaving people at an already vulnerable time feeling really isolated and alone and overwhelmed. So I think that's probably one of the biggest contributors to the stress and anxiety that the population I served is facing.
Are you recommending that, Zoom calls, although someone can't help you physically with the baby, are still helpful?
Definitely. We are encouraging folks to take whatever reasonable measures exist to try to ensure that they're still able to get support. So definitely taking advantage of Zoom or FaceTime, being old-fashioned and using the phone and having phone calls with friends or loved ones is really important right now. And as I think that with regard to vaccines and other reasonable measures that have been offered to us, like masking and great hand hygiene, these are things that we can use to make getting together safer and more reasonable. So that's something that I have a lot of conversations with my patients about as well.
Absolutely. And what are you talking to them about the vaccine? What are you saying?
Sure. There's understandably been a lot of questions and maybe even hesitancy with my population around the vaccine. It's new. People are concerned about how it might impact a pregnancy or a baby who's being breastfed or fed with breast milk. And so I've really tried to help my patients identify reputable sources of information through folks like the American Academy of Pediatrics and the American College of Obstetrics and Gynecology to guide decisions around vaccine safety and effectiveness. At this point, all of the reputable resources that we have point to strong evidence that the vaccine is safe and effective for women in pregnancy and lactating individuals as well. And so we are encouraging folks, but more than anything, we're encouraging folks to have conversations. If they're hesitant, if they're concerned, have conversations with their medical and obstetrical providers to make sure that they have all of the information they need to feel confident in the decision that they're making. I do talk with my clients about really working to understand risks and benefits. And again, all of the resources and the research that we have at this point to the notion that the benefits of staying safe and protected through vaccine far outweigh any of the risks that have been identified.
Absolutely. Thank you. And anyone watching, whether they think they may have, perinatal anxiety or one of the things we've already touched on, or is a little worried about developing some of those things as they get farther along, what coping mechanisms should they keep in mind, or should they try to kind of lift their own spirits?
Yeah. So first and foremost, I always try to remind folks to be patient with themselves. This is a tough time. Like you said, with COVID, this is a really tough time. And then add pregnancy or adjusting to having a new baby, and it becomes even more stressful. So making sure that we're being patient with ourselves is really important. Taking some time to try to let go of things that aren't essential at this point is also really reasonable. I'm not going to pretend to know why, but there's something about pregnancy and welcoming a new baby that tends to spur people into trying to take on an awful lot. And I spend a lot of time in my sessions encouraging folks to think about whether or not that's really practical and helpful. And so I encourage people sometimes to, let this be a time of quiet and sort of focusing in on self and baby and family and letting go of some of that other stuff. If there's anything that I would love to see folks pick up, it's getting outside more. So I definitely encourage people whenever possible to try to get outside at least once a day, every day. Fresh air and physical movement are so essential for our physical well-being as well as our emotional well-being. So I really encourage people to do that.
Absolutely. And if someone is looking to take advantage of the resources for the Center for Women's Emotional Wellness, how can they get in contact with you?
Easiest way to get in contact with us is by telephoning 302-733-6662. We also have an email. It is CWEW, that's what we call ourselves, CWEW @ChristianaCare.org. We have a fantastic team of 3 administrators who help to manage all of our intake calls and requests for appointments. We have an intake coordinator, so when people do request an appointment, they will have a brief interview with our intake coordinator to sort of review their symptoms and make sure that CWU is the appropriate place for them for services. And then they'll get scheduled for a comprehensive evaluation with one of our therapists or psychiatric med providers, depending on the needs of the patient, at which point we'll go through a full interview and get all the details to try to better understand what the major concerns are and what's the best plan for treatment so that we can get people feeling as well as they deserve to feel.
Before I let you go, what is the #1 thing you want women to take away from this conversation?
So my colleagues over at Postpartum Support International, which is the largest nonprofit dedicated to this cause, they really say it best, which is you are not alone, you are not to blame, and with help, you will be well. And I believe that wholeheartedly, and I share that with my patients each and every day. This is a really common and overwhelming situation, perinatal mood and anxiety disorders, but it's also incredibly treatable. So when people reach out for help and they're able to get that help, they really will get better. It's the best part of my job. It's hard to see people come in and be struggling, but it's awesome to see them get well.
Elena Spirito, thank you so much for your time today. We really appreciate you sharing all of those resources and tips, and I'm sure we will talk again soon.
Thank you so much, Megan, and best of luck to you and the rest of your pregnancy.
Thanks so much. Have a great afternoon, everyone.
Take care.